Welcome back, Focus Learners. I am so thrilled to have you here for part 20 of our 150-part IPDRG Masterclass. You know, in our last session, part 19, we really laid the groundwork, didn't we? We got a solid overview of Character 3, exploring those 31 root operations and the 9 intent groups. Well, today, we're taking a deep dive into Root Operations Group 1. These are the procedures that take out some or all of a body part. Before we jump right in, I have a quick favor to ask. If you are enjoying this lesson, please like, share, and subscribe to this channel, and share it with friends for this free course on Decode Healthcare with Harshal. All right, let's get into it.
Okay, let's dive into this outline. Today we're looking at excision versus resection, then we'll tackle the biopsy extraction exception, move on to detachment and extremities, and finish up with a quick review and next steps.
First up, excision versus resection. We're actually tackling the biggest coding hurdle right out of the gate here.
So the crucial point you have to remember is the scale of the removal. Both of these involve cutting out or off a body part without putting anything back in its place. But here is the key distinction. Excision, which is character B, means you are only removing a portion of a body part. Basically, you're leaving some of it behind. Resection, on the other hand, is character T, and that means you are cutting out or off absolutely all of a body part. Getting this distinction down is literally the bedrock of assigning the correct ICD-10 PCS code.
And this brilliantly illustrates what I mean. Take a partial nephrectomy, for example. The surgeon uses a sharp instrument like a scalpel or maybe electrocautery to cut out just the specific portion of the kidney that contains a tumor. Because the portion of that kidney remains completely intact, this is definitively an excision, meaning we use character value B. Other really common examples you'll see are excisional debridements or breast lumpectomies. You're just taking a piece, not the whole thing.
Now, what's really interesting about this next concept is how ICD-10 PCS actually defines the word all. Let's look at a total lobectomy of the lung, where just one lobe is removed. Now, you might be thinking, well, the whole lung wasn't removed, so isn't that just an excision? Actually, no, not in this coding system. In ICD-10 PCS, a resection includes cutting out any subdivision of a body part, as long as it has its own distinct body part value. Since the upper lung lobe has its own specific value, removing that entire lobe is coded as a resection character T. The rule of thumb here, always code to the specific anatomical subdivision whenever you possibly can.
Let's cement this with a foundational coding rule, specifically regarding lymph nodes. If a surgeon removes an individual lymph node, or even a few individual ones, you code that as an excision. However, if that operative report specifically states that an entire lymph node chain is cut out, your root operation shifts immediately to resection. Just remember, a resection means taking the entire body part or the entire distinct subdivision.
Let's move along and see how this builds into our second topic, the biopsy extraction exception. Okay, so for most standard biopsies, like a percutaneous liver biopsy for instance, we just use the root operation excision. The surgeon cuts out a tiny little portion of tissue for analysis. In these standard, everyday cases, you simply apply the qualifier diagnostic, which is character X, and that tells the coding system this excision was performed specifically to get a biopsy. But wait, what happens if the tissue isn't neatly cut out? Well, this brings us to extraction, which is character D. Extraction is defined as pulling or stripping out or off all or a portion of a body part by the use of force. So it's a completely different mechanical action than an excision.
And right here is the major exception you absolutely must memorize. Bone marrow biopsies and endometrial biopsies are not coded as excisions. And why is that? Well, because you aren't actually cutting them out with a scalpel. You're using a needle or a correct to forcefully pull or strip that tissue out. Because of that force, bone marrow and endometrial biopsies are always coded to the root operation extraction, still using that same diagnostic qualifier, character X, to identify it as a biopsy.
While we're still on the topic of biopsies, here's a vital sequencing rule you're going to need for your charts. Let's say a patient undergoes a diagnostic biopsy, and right after, during the exact same operative episode and at the exact same site, the surgeon performs a therapeutic excision or resection. Imagine a breast biopsy immediately followed by partial mastectomy. In that case, you code only the therapeutic procedure. The definitive treatment basically absorbs that initial diagnostic step. All right, let's guide our focus outward from the internal organs to the extremities for Section 3, Detachment and Extremities. Detachment, which gets assigned the character value 6, is strictly defined as cutting off all or a portion of the upper or lower extremities. It's absolutely crucial to note that you will only ever find detachment codes in body system X, representing upper extremities, and body system Y, representing lower extremities. Because amputations cross over overlapping body layers, they get this highly specific root operation all to themselves.
Now with detachment, the body part value gives us the site, sure, but the qualifier is the real star of the show here. The qualifier specifies the exact level of the amputation. For instance, a transhumeral amputation, where they cut through the shaft of the humerus, will use qualifiers like high, mid, or low to tell us exactly where on the bone that cut was made. A transradial amputation below the elbow works the exact same way.
The granularity gets even more complex when we look at the hand and the foot. A complete ray amputation means cutting all the way through the carpometacarpal joint, but a partial ray amputation means the cut was made anywhere along the shaft or head of the metacarpal bone. You really have to trace the surgeon's exact path past those MCP joints to get this one right.
Let's look at a real-world operative report example to see how this plays out. Surgeons use clinical shorthand all the time, right? A surgeon might write down that they amputated a toe. But when you read the fine print of that operative report, they actually detail extending the cut down to the midshaft of the fifth metatarsal. Well, the metatarsal is the foot, not just the toe. So your correct ICD-10 PCS qualifier wouldn't be just for a toe. It would actually be partial fifth ray. You always have to read beyond the basic terminology to capture what was actually done.
And that brings us to Section 4, Review and Next Steps.
First off, huge congratulations on making it through this. This is dense, highly technical material, and you're doing incredible work. Let's do a quick rapid-fire recap of the 5 root operations of Group 1, which are the procedures that take out some or all of a body part. We've got excision, character B, for cutting out a portion. Resection, character T, for cutting out all of a body part or a distinct subdivision. Extraction, character D, for pulling or stripping tissue out, which remember is heavily used for bone marrow biopsies. Detachment, character 6, for amputations of the extremities. And finally, to round out our Group 1 list, we have destruction, character 5, which is the physical eradication of a body part using energy, force, or some sort of destructive agent.
Think about how knowing these very distinct definitions is going to drastically improve your coding accuracy. Are you ready to apply these Group 1 rules to your next complex coding chart? I know you are for sure. Thank you so much for joining me today. If you are enjoying this lesson, please like, share, and subscribe to this channel and share it with friends for this free course on Decode Healthcare with Harshal. I will see you in Part 21.